Palm coin classification is one of the important classification in order to, define the, while you are dealing with abnormal uterine bleeding and, dysfunctional uterine bleeding and other causes of menorrhagia, with the help of the palm coin classification. Now we will discuss the, entire causes of the menorrhagia and all. Today I just want to tell you about palm coin classification. Okay. See, palm coin classification is divided into like uh, structural and non-structural causes of the menorrhagia, okay, or bleeding through the vagina from the uterus, okay, or any bleeding. First of all, polyp. P for polyp, adenomyomas, leiomyomas, malignancy, coagulopathies, ovarian disorders, endometriosis, iatrogenic causes, and N for not yet classified. So, this is the palm coin classification we are going to discuss now. And polyp. So, these are the subheadings we are going to discuss. What are the definitions, etiology, clinical features, investigations, management, both medical and surgical management. So, this is the palm coin classification. Now we are going to discuss. Okay, so let's discuss what is palm coin classification. Okay, first polyps. What are polyps? Polyps are nothing but the fibroids. So these are the fibroids which are pedunculated and growing. I mean, they are growing into the uterine cavity. Okay, these are nothing but endometrial overgrowth. Okay, so what is the main reason? See, polyps, because of the main, overgrowth. The main reason is the um, overgrowth of the polyps. They leads to menorrhagia. Everyone knows this, which the surface area increases. Because of this surface area increases of the endometrium. So wherever the endometrium is there, the endometrial tissue, its nature is to bleed. Okay, where okay, the endometrial tissue, the nature of the endometrial tissue is to bleed. So the polyps, so if there is an abnormal growth because of the endometrial cells or overgrowth of the endometrial tissue, or any fibroids are the overgrowth of the muscular layer, because of the cellular increase, I mean cellular growth of the muscle cells or smooth muscle cells, or fibro tissue deposition, or fibroblast cells or fibrocyte cells. All these are leads to the overgrowth, leads to formation of the fibroids. And the pedunculated fibroids, you know these are the polyps. They are most, I mean, they are uterine polyps, cervical polyps. Mucous polyps are the cervical polyps, and adenomyomatous polyps, sarcomatous polyps, or the uterine polyps. These are the types of polyps. So the main reason in order to deal with all these things is the abnormal bleeding, which leads to anemia ultimately. And abnormal bleeding, all these causes interlink to the menstrual cycle. Menstrual cycles, the main reason of the menstrual cycle, hormonal balance, and hormonal balance, mental peace, all these things are important. And pregnancy is the main thing. And in order to preserve the pregnancy, we always strive to maintain the natural function of the uterus, ovary, and other organs, and all the endocrine you know all the endocrine functions, all these things we need to maintain in order to you know provide a proper pregnancy, a good child, and a healthy baby to the world. So all these things we need to keep it in our mind. Hi, how are you all? After a long time, please, my name is Vijay Durga, and my name is Vijay Durga. I'm an MS orthopedic resident, and I have also completed my fellowship in obstetrics and gynecology. I love the subject and I'm interested. So I completed my fellowship, and you know, I'm also doing my clinical training in obstetrics and gynecology now. And see, lots of through orthoflash videos, I have uploaded more than 60 videos regarding the orthopedics. They are very, 5 to 10 minutes 5 to 10 minutes videos, those are directly, I prepared those videos directly from the textbook itself. So they are very easy to revise. And now I'm also adding the videos and lecture classes regarding the obstetrics and gynecology also. So please go through all the videos. It helps to revise quickly your chapters. These are entirely from the textbooks. And it helps you a lot throughout the you know entire lifetime. It helps you all. Okay, let back to the just okay, we will go to the class now. We'll continue the class. Okay, where am I? Yeah. So the main reason is to maintain hormonal balance, preserve the pregnancies, and provide a healthy child. All these are the main motives. Okay. So polyps, we I just completed the polyps, what are polyps, and types of polyps. And because of polyps, there is menorrhagia and all. Because of menorrhagia, there is an infertility or miscarriages. So polyps are, we need to diagnose through USG or hysteroscopy and all. So where is the polyp? We have to identify. And we will go according to the treatment. So because of polyps, if there is a menorrhagia leads to anemia, we will correct the anemia. So polypectomy we should done by simple hysteroscopic polypectomy. We can do the laparoscopic polypectomy. Everything we will, we will remove the polyps. And so that is the polyp. And so that is the polyps, regarding the polyps. And now coming to the second letter, adenomyomas. So palm coin classification, adenomyomas. Adenomyomas are nothing but the endometrial tissue in the myometrial wall or uterine. So why is this important? What is endometriosis? Endometriosis is nothing but the endometrial tissue in the abnormal places. So the endometrial layer is the inner layer of the uterus. Okay, it is the inner layer of the uterus which shouldn't be outside of the uterus. But because of the endometrial tissue present at the other sides, like mainly most common site of abnormal presentation of the endometrium is the ovary, and most common presentation is the chocolate cyst, and everyone knows that. And also, in the peritoneal layers. Not only that, there are lots of sites of presentation of abnormal presentation of endometrium. Cul-de-sacs and broad ligament, round ligaments. Rectum, sigmoid colon, ovaries. All these things in the bladder. So. Um, all these things, abnormal presentation of the endometrium, which ultimately leads to bleeding. So all these things because of estrogen increase, because of estrogen, which promotes the endometrial tissue. Um Estrogen and two phases, estrogen and progesterone. What estrogen does is the proliferation, and secretory phase is by the progesterone. So all these things lead to, when the menstruation occurs, there will be a endometrial bleeding also wherever the abnormal tissue presents. So ultimately leads to the pain. So the dysmenorrhea, adhesions. So all these things, ultimately leads to the pelvic inflammatory diseases and all. So all this abnormal presentation ultimately leads to harbors the infection. Lots of infections, like we will discuss infections in the entire chapter. So PID is the other problem. Now, um, this is endometriosis. So first of all, how to treat endometriosis is important. Endometriosis can be treated by using oral contraceptive pills, progesterone, mifepristone, norethistérone, all these things. See guys, I have already discussed the hormonal pills how to use in the puberty, reproductive age group, and postmenopausal women. So all I have now I'm going to tell you that endometriosis we will use the progesterone of high doses of more than 10 mg to 30 mg, 60 mg. Depends upon the severity of the endometriosis. Not only that, we also use other drugs like danazole and other drugs we can use and GnRH. All these things, GnRH also helpful in the reduction of the endometrial tissue or shrinkage. All these things are we will use. Okay, endometriosis. So how in investigations like we will find the abnormal tissues like puckered spots and burned out spots, chocolate cysts, or yellowish discoloration if it is present in the endometrium and all. So all these are the investigational findings, and we will laparoscopic findings and all. So laparoscopy can be either be diagnostic and therapeutic. Okay, laparoscopic. So we will ablate the endometrial tissue, abnormal endometrial tissue. Okay, and things to be remembered that if endometriosis in the reproductive age group women, if she wants a contraception, so we can't prescribe OC pills or IUCDs. Both increases the pain and increases the proliferation of endometrial tissue. So for her we suggest like spaces, condom or centromen. So centromen and condoms are all non-hormonal things which are used for endometriosis and reproductive age group women for contraception and all. Okay, this is endometriosis. And now, okay, now we are coming to um, adenomyosis. Okay, we will discuss the adenomyosis. Okay, this is endometriosis. Coming to the adenomyosis, the abnormal this endometrial tissues in the myometrial wall or uterine wall. So this is called adenomyosis. So what is the main difference between adenomyosis and fibroids? So fibroids are the well capsulated circular lesions which can be seen in the USG. But in adenomyosis, they are not ill-defined hypoechoic lesions and multiple lesions. You know this is not uniform. And other thing is adenomyosis doesn't grow more than 12 weeks, but fibroids can grow more than 12 weeks. Okay, so all these things we have to keep it in our mind. And estrogen promotes the growth of the fibroids or endometrial tissues. So avoid estrogen, okay, prescribing estrogen in these conditions. Progesterone helps to shrinkage of the fibroids and all. you know, we use mifepristone, and we use mifepristone and other drugs like we use other drugs like uh, mifepristone we use, and some other drugs like lots of drug not lots of drugs. For fibroids we use mifepristone and GnRH. Okay, buserelin, guserelin, all these things are there. So in low dose. And one more thing we have to remember that GnRH should not prescribe more than 6 months. It should be prescribed for 3 to 6 months, not more than that. So all these things we have to keep it in our mind. Okay, so now I discussed adenomyosis along with endometriosis. So adenomyosis, first of all, we have to treat with NSAIDs, and we will use NSAIDs and other things like we will go for you know medical management with progesterone and all, and which is used for the shrinkage and controls the bleeding and all. Next we have to if she is not willing you know uh, pregnancy, and if she want to go for family planning, or at that time if she not diagnosed with endometriosis, and if all medical management, conservative management is not working, then we will go for a hysterectomy. Whether it is abdominal hysterectomy or vaginal hysterectomy, laparoscopic hysterectomy, we will do our open surgery, open hysterectomy we can do for the adenomyosis women. Okay, next. So palm coin classification: polyps, adenomyomas, along with endometriosis I covered now. Now I want to tell you that fibroids, leiomyomas. So leiomyomas are fibroids are nothing but the abnormal growth of the tissue, like smooth muscle cells in the myometrium. So myometrial tissue and abnormal fibrous tissue is grow to form the fibroids. So these are the fibroids. Lots of types are there. So according to that, we need to know what are the fibroids. See, fibroids are intramural fibroids, or subserosal intramural fibroids, or interstitial fibroids, and serosal fibroids, subserosal fibroids, and submucous fibroids. So first of all, uterine layers are very important. So uterine layers, outer layer is the serosa, um, middle muscular layer, which is thick layer, circular muscles, longitudinal muscles are present, and with connective tissue, and deeper layer is the endometrium or mucus layer. So serosa, or perimetrium, or the outer layer, which is covered by the peritoneum. So these are the things. So abnormal growth in the myometrial tissue or smooth muscle or growth. So if it is presented, growth towards the serosa or subserosal. Those are the serosal fibroids, and submucous fibroids are the endometrial grow towards the endometrium or into the cavity, and in the myometrium. In the myometrium, those are called the interstitial fibroids, or mm, um, those are the interstitial fibroids and intramural fibroids. So these are the types of fibroids. So why fibroids are important? Because of fibroids there is an abnormal bleeding. The main presentation is bleeding, low back pain, and pregnancy complications, and anemia. All these things are the presenting features and the problems. Okay, so fibroids, and there's a lots of pain. Okay, then now, so estrogen promotes the growth of fibroids, and progesterone helps in shrinkage of the fibroids. I discussed already, and so we have to keep it in our mind. There are lots of types of fibroids. Hyaline, because of the degeneration, hyaline degeneration, sarcomatous degeneration, red degeneration. So red degeneration is important because it is seen in the pregnant women. So it causes a pregnancy complications and all, and very much painful. Okay, these are the red degeneration. And we need to, what is fibroid has a capsule. Okay, so it has capsule, it has cells. Okay, abnormal cells, and uh, abnormal cells, and it consists of endometrial glands and all, in the histopathology. And glandular tissue is also, adenomyosis, endometrial glands are also present in the histopathology. So uh, just remember, the blood supply is peripheral blood supply, and there is, some degenerations like calcific degeneration is also observed, and calcification along the vessels is observed. Okay, and these are the features we can observe. Some, abnormal overgrowth can observe with the naked eye, or these are the histopathological examination. Okay, so next, so these are the complications. Like red degeneration is a complication in the pregnancy. Okay, and So fibroids are important. So how to deal with the fibroids? Mifepristone we can use in order to shrinkage, and progesterone we will use more than 30 mg and all. So and we also need to remember 84 days of continuous continuous OC pills. Just 6 days of free of OC pills. That much strictly we suggest. Mm, Sorry, in endometriosis we suggest 84 days, complete 84 days prescription of ossiples. In fibroids we will month, 3 months, 2 months and all, up to 6 months we will prescribe those ossiples or progesterone, mifepristone and all. Okay, all these things keep it in your mind. And because in order to shrinkage of the fibroids, so after the main purpose of the shrinkage is to decrease the bleeding during myomectomy or fibroidectomy, fibroid removal and all. So this is the medical management. Okay, so all the pain management, we will deal with the pain management mostly with NSAIDs. And okay, in order to control all these things we have discussed in menorrhagia, how to deal with the bleeding and all. Okay, okay, these are the fibroids. And how to diagnose. In the diagnosis, there is in color doppler there is a ring formation in the fibroid. We will observe the vascular ring formation in the fibroid. The same vascular feature for adenomyosis is the diffuse. In adenomyosis, diffusion of the vascular supply is observed. So this is the difference. And adenomyosis doesn't grow more than 12 weeks, fibroid grows more than 12 weeks. So these are the characteristic differentiating features. And histopathology also very much important. Okay, uh, so how to do myomectomy? After, see, first of all, the just swelling, because of the growth more than 12 weeks, just identify the fibroid and make an incision, open it, and if you see the fibroid, just cut the capsule, uh, just insert the myomectomy screw, and cut the base of the fibroidectomy. And after fibroidectomy or myomectomy, and just remove, and the bed should be you know sutured well, and close it. So that is the removal of the fibroid or fibroidectomy. So according to, it depends upon it depends upon the pregnancy or age of the women, whether to preserve preserve fertility and all. We have to keep it in our mind. So ultimate, after the completion of the family, she can opt, or she can go for a excuse me, she can go for hysterectomy. Okay, this is about fibroids. So we discussed polyps, adenomyomas, endometriosis, and leiomyomas. So coming to the malignancy or hyperplasia. So always keep it in your mind. In postmenopausal women's, after bleeding, or after attainment of menopause, keep it in your mind, endometrial carcinoma. And any overgrowth or hormonal overgrowth tissues, ovarian tumors, all the uh, sarcomas. See, sarcomas are also important. Sarcomatous changes. The distinguishing feature of sarcomatous is they are non-capsulated. Generally, fibroids are capsulated. These sarcomatous fibroids are malignant, and they grow rapidly. So sarcomas and all, we have to keep it in mind. So these are the malignant features. Endometriomas, and I mean, generally endometriosis is a benign condition, but it can go for malignancy. Polyps are also benign condition, but some polyps are, some percentages also go for a malignant changes. Okay, so this is about malignancy. So each and every malignancy we will deal. First of all, if you know, the grading is important. Coming to each and every grading is really important, and according to the gradient we will if it is benign malignancy, again histopathological examination and all. So according to that we will go for entire tissue removal or entire tumor removal. We will go for it. We will go for chemotherapies, and we can also go for radiotherapies. So entire malignancy also we will discuss very clearly. And this is about malignancy. Now, palm coin classification, coming to the coagulopathies. So coagulopathies, like bleeding disorders like von Willebrand disease, von Willebrand disease, and other diseases like mostly von Willebrand disease, or factor 8, factor 9 deficiency, and platelet disorders. All these coagulation disorders, vitamin K deficiency, and all these things coming under the coagulopathies. And hemophilias are the bleeding disorders. Hemophilia A, hemophilia B, all these things are coming to the bleeding disorders. So coagulopathies, how to how briefly I can tell you that. Just simply I can tell you how to deal with coagulation disorders, like um, see, vitamin K dependent and vitamin K independent. So all the drugs are like vitamin K dependent and vitamin K independent drugs are there. And like antithrombins, antiplatelet drugs. All these things are useful in controlling of the, you know, coagulopathies. So next we are going to, like this is about coagulopathies. And um, direct thrombin inhibitors, like uh, dicomerol, and all these things are there. Okay, these are we will discuss. And this is about coagulation disorders. And you know like we know lots of drugs are there. And I will provide the notes about towards the coagulation disorders in the post or in the comment section. And now we will discuss, after coagulopathies, what else. Ovarian dysfunction. See, ovarian dysfunction, mainly PCOS. Already we discussed previous classes PCOS. So main the Rotterdam criteria is important: oligomenorrhea, hirsutism, and USG findings of more than 10 follicles of each size of more than 9 mm. Those are the atric follicles and all. So these are the presentation of PCOS. Lots of causes, metabolic disorders, not only the ovarian dysfunction, other causes like metabolic disorders, insulin resistance, obesity, you know obesity and all these things. All these things are also causes for PCOS. Not only PCOS, hyperandrogenism, or uh, like cortisol dysfunction, adrenaline dysfunction. All these things are causes of the abnormal menstrual disorders, and causes for the PCOS. So PCOS is also, keep it in a mind, a puberty, how to deal with the puberty girl, how to deal with a reproductive age group girl, reproductive age group women. It is important. So preserve the fertility is the main motive. So clomiphene citrate, dexamethasone combination, gives the good results. More than 80%, 50 to 80% of chances of getting pregnant. Clomiphene citrate and dexamethasone at bedtime, and clomiphene citrate for 6 days and all. We will give. These are like ovulation induction. In PCOS, if the pregnancy is not attained, not attained, or any Infertility also we discussed. So ovulation induction we prefer, or artificial reproductive therapies, and IUIs. Okay, IUIs, embryo transfer, all these things we will do. Okay, in the infertility related to the PCOS, and infertility because of other causes. Okay, so this is PCOS. So always keep it in mind. So not every PCOS is because of hormonal issue. So um, so in PCOS, the FSH and LH ratio is increased. Okay, um, and LH and FSH ratio is increased, FSH decreased, and all. So all these things, estrogen is also decreased, and ovulatory cycles. Okay, there is no ovulation and all these things we have to keep it in our mind. So this is all about PCOS. And coming to um, what next, in palm coin classification, coagulopathies, ovarian dysfunction, endometriosis, and hyperhydrogenic may be due to any one more thing I missed. Keep it in your mind. Fibroids have the feeding vessels. The blood vessels are there. There is proliferation of new growth of new vessels. You know, just keep it in your mind. Embolization, uterine artery embolization with the polyvinyl alcohol. It is also, in order to decrease the blood supply to the fibroid, thereby it can, helps in shrinkage of the fibroid or decrease in size. Okay. Now, occipils, sorry, ovarian dysfunction. You know how to deal with ovarian dysfunction now, PCOS and all. See, in general, puberty age group girls after puberty. Now we will prescribe combined oral contraceptive pills and all. Okay, this is about PCOS, and so CFA coagulopathy, offer ovarian dysfunction, and other iatrogenic. Coming to the iatrogenic, see, bleeding because of any procedures are happening, any tears, rupture of the uterus sometimes, um, any rupture or iatrogenic causes are during, procedures like sometimes uterine, sometimes fundal height measurement or uterine sound. We used, instrumentations and all properly we use, leads to the bleeding and all. And so all these things we have to keep it in mind. Iatrogenic and other not yet classified. These are the conditions, other cases in palm coin classification. They didn't classified, like bleeding occurs, but uh, they doesn't classified in the not yet classified. In not yet classified, whatever we discussed in the entire palm coin classification, they might, it also won't be those things. Okay. So hi everyone, how are you all? um, Please subscribe auto flash videos. Please follow and support the channel, and please go through each and every video. It will helps you a lot. And any doubts, you can leave comments in the comment section. And thank you everyone. Thank you everyone. Thank you guys. And one more thing, please also check the posts, check the comments. I will provide notes in the comment section and in the posts. So also please go through all those things. And whatever missed, or if if anything I missed, or is there any corrections or anything else, I will post in the posts or in the comment section. Thank you everyone. Thank you all.